My name is Dee Cole DePoe, and I'm an adult services librarian at the Shelton/Hoodsport Library. My family has lived in Shelton or in Mason County since before Washington was a state. I have the best job because I get to put people with resources. The addiction has touched my family. Prior to us doing the library doing the program Come Together Mason County Addiction Awareness, 2 weeks before that my daughter died. Her death was considered undetermined death, but one of the factors was she was an IV drug user and had been for about 4.5 years. This is our daughter Amber with her adorable son Andrew.
What do what do you do? It's got to be an awful thing to see your child die, especially when she had a little boy, and so that little boy has grown up without a mom. But you see it everywhere in the county, all of these young ladies and women that just can't seem to break free.
It is a small town, as we all know, but it's a town that has so much heart. There's so many people that care. It's a town that's been beat up economically at different times in its history, and we continue to try to dig our way out.
Somebody described it once as a great town, a little rough around the edges, which describes it very well, very well. I wanted to be able to come to a place where the community was involved, the people were involved, and you could, like I said, a small amount of people can make a huge difference in a town like this.
We have beautiful scenery and natural resources, but really our health indicators are awful.
When I got here, I was shocked at the amount of heroin on the streets, at the amount of heroin addiction you see on the streets.
Looking at the current data that was available then and what was coming up, this community work group decided the priorities. If you look at social determinants of health, you'll see that access to food is not the only thing that makes you eat healthy. So behavioral health has it's really sad. It's nationwide, probably worldwide, but it ties into people with mental health or trauma in their childhood or younger years and not getting help for it, and then self-medicating.
Well, mine started very young. Like most people, I honestly started on inhalants. When you're a kid and you find markers, you're like, ooh, markers. And then that just went on a progressive thing of learning more inhalants, and then that progressed onto cough syrups that are mixed with oxycodone or other hard things like that, and that went to pills. I finally learned how to do pills, and then that was where my spiral went bad.
And then there was the whole OxyContin availability, and so kids were snorting that or smoking it, and then when they changed the formula so you couldn't do that anymore, I won't say, somebody was ready with another product, and that happened to be black tar heroin. It was cheap, it was an opioid just like the OxyContin, and a lot, unfortunately, of our residents in Mason County got hooked on it.
For us, it was a roller coaster. Amber had a boyfriend once that had been hurt, and he was prescribed opiate drugs. And from there, she also got hooked. And when they changed the formulas for the opiate drugs, she later went to heroin.
It's cheap, it's addictive, and easily, it's not hard to get. It's easily obtained. So you take those three things in combination, it's just, and people will there are studies out there, a variety of reasons people get addicted, anything from alcohol to heroin, from troubled times in their life to genetics to, I mean, there's a variety of reasons why people get addicted. The reality is when you can find something like this that makes you feel that way, cheap and easily obtained, that's what happens.
Like, it's a temporary mental disease when you're actually addicted and using. But then at the same time, that addiction mentality stays forever sometimes.
It's like any other mental health disease. It's a disease. It's not a defect in character.
Like, I still definitely always have thoughts of going and using something again, and I haven't done so. I'm proud of myself for that, but it's very hard on some days. Some days life just wears you down a little harder than others.
We didn't understand the scope of the disease. Unless you have the disease, I'll never really completely understand. And if you could just quit, if you could just go to meetings, if you could just go to rehab, if you could just take this medicine. We enabled, we were direct, we were abrupt, we did all the right things and all the wrong things, and sometimes all at the same time. She had been, she'd been previously in the hospital and had had an infection that had gone into her hip. And she was, at that point, really sick. And when she got out of the hospital, she had a hard time walking. She walked with a walker for a short, brief period of time. And then, of course, then they would give her opiates for the pain. And then it progressed. In the hospital, the very last, I have to say I was a little irritated with her. I was tired of this. I wanted her to get help. And I couldn't even fathom that this would be the last time that I would see her. She was in the hospital for 6 weeks, about 4 months prior to her death, and then she was in the hospital a week and a half before she passed away. The last time that we saw her in the hospital, which is a couple of days before she left, I was mad. I was mad that she was putting herself through this, putting her little boy through this, and probably mad that she was putting us through this. I didn't want to give her a hug. I was mad at her, and I am so glad that I gave her a hug and told her I loved her. But, you know, I wished I would have done so much more. I wished I would have told her what a wonderful individual she was and what she meant to us and what a great mom she was, and that I was proud that I was her mom.
Narcan is used when somebody who has overdosed on an opiate, it's used to reverse the effects of the opiate. So a lot of times when someone takes too much of an opiate, they can become short of breath, they can even stop breathing, they start to turn a blue color, they're very unresponsive to anything.
There was a time that I had overdosed and I woke up hours later, barely breathing, barely remembering anything. And all I knew is I'm looking at my phone and someone's asking me if I'm okay. And I'm like, I'm alive. I guess I'm okay.
I'm really pleased that we have a police chief here in Shelton that has an open mind and does research, because he thought he was against it. And we had the opioid forum at Shelton High School.
And he was asked some really hard questions. And one of the questions that he was asked was, why does the Shelton police, why are they not carrying Narcan? And he didn't defend it. He just said that there were some things that he needed to vet.
And frankly, I told the crowd then, first of all, I'm not up to date and educated on everything Narcan can do. And I told him, I said, I've got to do some more information, but I'm not comfortable us distributing medication. Especially when then, because I didn't know. I'm thinking bee sting, shot. You know, you have a tough time as a law enforcement officer going, okay, I'm just going to hand it over to the patrol officer and he's going to give you a shot, then diagnose you in that quick second. Talked to the doctors, did some research, talked to several folks across the country, and they gave us a nasal inhaler and told us this is the least intrusive, best way to go about it, and the officers here embraced it. And within several months, they had 3 saves.
I have, like everybody else, seen news stories that, well, you know, it just allows them to use again. Well, it's like anything else. CPR, an electric defibrillator, it doesn't change the habit, but it gives them an opportunity to live.
Some people will say that, you know, why even try to save these people? They're making the choice of using these drugs, and they know that that they could overdose and die, or their heart could just not take it. You know, there's lots of different, you know, ways to look at it, but you know, maybe, you know, it's survival of the fittest kind of thing, where, you know, you're making these choices for yourself. But just think about if that was your kid, or sorry, or your brother or your sister. Would you want them to try to save them? Would you want that one more chance that maybe they would quit using these drugs? Of course you would.
Well, in Mason County, we currently don't have a lot of options. So we have an inpatient facility in downtown Shelton for men. They have outpatient at that very same facility for men and women.
Mason County is unique in that we don't have contracts with any of the other service providers for women in other counties, whereas for men we have contracts with other counties for beds that we can send men to get clean and sober.
More treatment centers have opened up more beds, but still sometimes somebody's ready to go to treatment, they maybe participate in drug court, so then they have to go to jail until they get into treatment.
The history of drug laws were not created based on the substance and the effects of the substance. And now that heroin is touching white families, the attitude of drug treatment is changing. And I think it's really sad that it took white families being affected for the attitude to change. It's changing from one of punishment and criminalization to one of treatment. And I think that's really important.
And frankly, for somebody with mental health issues and drug addiction issues, jail's not the place for them. It's not going to help. You know, the jails are the largest mental institutions in the state of Washington, which that should not be the case.
I feel like mental health counselors help somebody identify maybe why they use. Maybe they help identify the emotional pain the person's experiencing and help that person work through that so that the person can resolve whatever feelings it is that's leading to the use of substances.
For whatever reason, like some places you have to fill out like forms and paperwork and stuff for. It's like, I'm sorry, I'm about to go shoot up. Why am I going to sit here and fill out paperwork? This is not what I want to do. That's rather what I'd want to do. Like I've been to that.
There is a treatment in Lacey that a lot of our residents use, and if they don't have transportation, there is paratransit available, but it is difficult.
Before they changed the way Medicaid is delivered through the BHO, you had to get yourself to the methadone clinic, and we do have a bus system here, but it's a small system and it's not free. I think you can get vouchers, but it's quite a lot of work. The clinic, I think, they close at like 10 in the morning, so you have to get there early. So you have to get up and take a bus at 6 in the morning and ride over, and you have to change buses to get out to Lacey. And then you do what they call a dose. So they give you your methadone, and then you get back on the bus, you make your way back, and you know, the day is almost shot. If you have a job, it's really difficult to be able to do that.
This community needs to have an inpatient treatment center for women. I think that's very important, in addition to the outpatient treatment, women need to have the chance to go inpatient and detox in their local community. It's very hard for a lot of these women because they have codependency issues. It's hard for them to agree to leave and go 2 hours away and leave their friends and their family. It would be much easier to get them detoxed, to get them started on the path of healing, which does involve breaking those patterns of codependency. And I really think that if we had the chance for these women to detox, we'd have a lot more women on the path to living healthy, happy lives and being good contributing members of our community.
The money that the county put up to buy a building in Shelton to house the triage center, with the hopes of having funding to turn the upstairs into a detox center, which is really badly needed.
You can have the full body problems. You can have the headaches, the chills, the shakes, the lack of appetite, the immense appetite. You can get very depressed, very angry. You can lash out, lash yourself. Suicidal tendencies are a very high thing when you're first coming off.
So a lot of people don't go into treatment because they're afraid of how bad they're going to feel and how sick they're going to be. But if you have a detox center, you can medically detox them so they don't have to go through all those terrible withdrawals.
But there's no follow-up with services. And that's where we're lacking right now drastically, is the follow-up services. We can save them today, but where's the follow-up services to get them into the resources tomorrow?
Having treatment, education is the first part. Having treatments that are available to all is very, it's the difference between life and death. We have a large problem in Mason County. We have a large problem in the United States with opiate addiction.
If we can get together and align our goals so that we support each other, then I think we'll get farther along. And it's just a matter of connecting with different resources.
We as a nation have made strides. We have made strides in Washington State, and especially in Shelton. Is it enough? No. We have a big problem, and it's going to take continual funding, continual awareness, advocacy, and probably a bunch of stuff I don't know.
I've seen too many of the girls that I've worked with pass away. And I know that if we change some of the services in our community, that wouldn't be happening. I know if we have a better supports in our community and a better response in our community, that these girls are not going to be dying, that these young people are not going to be leaving us when it's not their time. We need to show them that we love them and care about them, and teach them that they can love and care about themselves and that they can beat addiction.
When I first went in, I was actually going to be getting my GED, and when I got in, they told me that I have to finish high school, I have to graduate, and when I went ahead and did that, and they handed me my diploma, I just started crying. I was like, I didn't think this day was going to happen. I thought I was going to be dead by the time this happened.
Everybody knows somebody who knows somebody, or they really don't know that they know somebody that is affected by this epidemic.
You've got to have supportive law enforcement. You've got to have supportive city management. You have to have supportive community groups.
I can't fix everything, but I can at least maybe plant a seed. And so even if you leave that little seed behind that germinates and something comes from that, I think then that's a win.
I didn't give up hope, and we lost something, but I still have my daughter, and I still have her memories, and I still have a lot of things from her. And if through the efforts that the community is making towards addressing this epidemic, help one family, help one individual, I will feel like progress has been made. And that's something that I would like to see.